Hello friends, let us now learn about the next vector, which is ticks. Ticks are divided into two types. We have hard ticks and soft ticks. Hard ticks is Ixodidae, soft tick is Argacidae. The scutum is present in hard tick and absent in soft ticks. Head is present at anterior end in hard tick and lies ventrally in soft tick. Spiracles are present behind the fourth coxa in hard tick, and the spiracles are present behind third and fourth coxa in soft ticks. Eggs are around 100 to 1000 in one sitting are laid by hard ticks, and soft ticks lay around a batch of 20 to 100 over long periods. Nymphal stages are 1 in hard tick and 5 in soft ticks. Habits: hard ticks cannot stand starvation, whereas soft ticks can stand starvation. The next vector which we are going to learn now is about the housefly. Housefly are the signs of insanitation. Housefly include the signs of insanitation. They are the important species, that is Musca domestica, Musca vicinea, Musca nebula, Musca sorbens. These are present in situations where there are different breeding places. So the lifespan of housefly is 15 to 25 days. The eggs live for 8 to 24 hours. Larvae or maggots live for 2 to 7 days. Pupae lives for 3 to 6 days. An adult mosquito lives for 5 to 20 days. Then the important breeding places of housefly include the fresh horse manure, which is most important site, human excreta, followed by manure of other animals, followed by garbage. Then we also have decaying fruits and vegetables, followed by rubbish dumps with organic matter are the important breeding places. Then the feeding habits. One important thing is housefly never bites. Housefly cannot eat solid foods. It mainly vomits on the solid foods, and it vomits all the gastric juices, and as a result, with the help of the gastric juices, the solid foods are digested and form solution, and this solution is sucked in by housefly. This housefly is a mechanical vector forming the porter of infection. Then it will also transmit through vomit drop and defecation. Then the diseases transmitted by housefly are, has a housefly acting as vector of disease, and it also acts as a causative agent of disease. As a vector of disease, it transmits typhoid, paratyphoid fever, diarrhea, dysentery, cholera, gastroenteritis, MBBS, then helminthic manifestations, poliomyelitis, yaws, anthrax, trachoma, and conjunctivitis. As a causative agent of the disease, it is myiasis. Then we have sandfly. Sandfly include mainly Phlebotomus argentipus. Sandfly is the next vector. First, Phlebotomus argentipus causes Kala azar or visceral leishmaniasis. Then Phlebotomus purpuratasi will transmit sandfly fever or oriental sore or cutaneous leishmaniasis. Then Sargentomia punjabiensis Phlebotomus sargenti will transmit oriental sore and cutaneous leishmaniasis. Sargentomia punjabiensis will transmit sandfly fever. The habitat of sandfly is it lives in holes and crevices in the walls, holes in the trees, dark room, stable and store rooms. Sanitation measures carried out for a distance of 50 feet. This sandfly is for sandfly insecticide of choice is DDT, where we give 1 to 2 gram per meter square through single application. DDT is sprayed up to the height of 4 to 6 feet of walls. As sandfly cannot fly, so if we just spray till 4 to 6 feet of walls, then that is sufficient. It hops only. Only female sandfly will bite, and this female sandfly requires a blood meal every 3 to 4 days for oviposition. Then the next important vector is rat flea or Xenophila. Rat flea is a vector for bubonic plague, murine or endemic or flea-borne typhus, and chiggerosis. It is a host for Hymenopus diminuta, rat tapeworm. It is a host for Hymenopus nana, which is dwarf tapeworm. Then rodents. Rodents are vectors for different diseases. For bacterial diseases, rodents are vectors for rickettsial diseases. In the bacterial diseases, they are vectors for plague, tularemia, salmonellosis, and in the rickettsial diseases, they are vectors for scrub, typhus, murine, flea typhus, rickettsial pox, and also some bacterial diseases like leptospirosis and rat bite fever. They are also vectors for viral like Lassa fever, hemorrhagic fever, and encephalitis. They are vectors for parasites like Hymenopus diminuta, leishmaniasis, amoebiasis, trichinosis, and Chagas disease. So these are the important vectors in entomology. Thank you for watching my lecture. Thank you.